usually shave a patch like that.
I want her to be able to take this treat and not even lean backwards. So this makes this really not a great technique in the grass.
Yep.
Okay. I'm going to take you back inside. There's enough hot dog treats out there now.
There you go. Good girl.
So is she showing any problems? Pay attention to the fact she's like not coming right up to me, right? I'm not always stopping her with the hot dogs now. Some of this, good. One thing to think about here. Just take her away, collar. One thing to think about is why she chose to sit at that distance. So it's one of the things that makes me think, as you said, has she had surgery? Is there something going on? Because if she was really comfortable, I would expect her actually to come closer. Like her behavior, demeanor, and the distance she's choosing are not quite adding up to me. She's not hesitating, but dogs that have back problems, there's a limit to how much they can crank this.
Right.
So instead of coming close and now having to do this, right, she says, I can look you in the eye comfortably from here. So you'll see this from a performance point of view, where you're trying to get a dog to do a really clean front and a really close front for obedience or rally, and they keep sitting back. And you can use any technique you want till hell freezes over. You can clicker them, and as soon as that target's gone, the dog is going to go back to what's comfortable, and then the more distressed she is, or more panicked or worried, the worse mild discomfort or slightly tight can become much more tight, because anxiety has that really nice effect. So just do me a favor and just run your hand down her back, nice and gentle. Where was the spot that you were?
Right there. Oh, I think it was somewhere like right here.
On both sides.
She's not doing it
You
now.
see, watch his left knee. You see this left knee?
Yes, yes.
Yep. Do that again and just watch her left knee.
Yeah, kind of collapses.
See it? It rotates out.
Yeah. Really? Wow.
Yeah, go ahead and do it where you can see it, Michelle. So I would take that really. So you see the shift in this dog right there? You can stop.
No, you know what? The fur actually feels different.
She's telling me now to stop. Okay, so her demeanor changed, her facial expression changed, her breathing changed. She started yawning. She's like, so you can stop doing that part now, right? Because this is what's happening. And she's standing there, and all you were doing is running your hand down her back. These legs should stay stable. She's doing this.
Yeah.
This left knee
Rolling out.
is rolling out.
Yep.
So I'm wondering, and you look how she's sitting there, right? So she's in nice shape, she's in nice weight, she's got good muscle. But this is a very sprawled sit. So that normally a dog that's healthy sits, that toe will be right under the fold of the knee, a nice tight sit. She's sitting like this. So she's got herself rocked back to just avoid that. So I just wonder, and again, it's her body, right? So this is the body she grew up in. I don't know that it's always possible. So just let her be for a minute. So I'm just wondering if there's not some physical component where she says, I did try to tell you guys, and so it just becomes a layer where just as she did there, you were just simply trying to figure out what am I seeing. She's already given you 20 signals. I think the video would be useful to you.
Yep.
Her face changes, her mouth partially closed, her eyes stopped moving. She yawned again. She's like, those are really clear signs, but they're subtle. And if the volunteers and the rescue folks don't know that is a signal, we can get in trouble.
She did the same thing when she was adjusting her harness up here. She didn't get to yawning, but she did all the other things like...
Yeah, please don't. Hey, Clary. What are you doing? You're a Celtics fan. Are you kidding me? Really, it's reflexive, right? If you do this and something's in a dog's visual field, they'll follow it. She's not. Which is the other thing I want to,
What is she looking at? Is she just looking at your eyes? Is she looking
She's
down?
kind of like vaguely here.
Okay. There's
Is
no
that
real,
being overly aroused in narrow peripheral field, or
also be that, right, that she's not seeing well inside. So this would not be the first dog on the planet, right?
Right.
So we're in an unusual spot in that the person handling the dog was an eye surgeon, correct? Now we get to ask cool questions. So, from a visual point of view, right, there's not a whole lot of seriously good info for dogs. But one of the things that I always look for as a trainer is, can the dog follow? There should be a reflexive orientation to things moving in their visual field. So sometimes you'll see with dogs when it's close, they can't, they're too farsighted. You'll see the opposite, it goes too far, it's right off the dog's chart, it's nearsighted. And anxiety and arousal can certainly affect it. That treat didn't even exist.
She
So
might
she
have,
sees the contrast on the floor. You're eating all of Marvin's food, I just want to point that out. What is the puppy gonna